Hi, welcome to our channel. In this video, I'm going to talk about the difference between a regular cleaning and a deep cleaning. Let's start with the number one, the primary goal and purpose. With a regular cleaning, or what we hygienists call a prophy, that is preventive maintenance, we're not addressing an active problem. We are just doing routine care. You may compare this to an oil change in your car. You get your oil changed regularly so that your car stays in good condition and you don't have any major problems. This is kind of the same way with the teeth and gums. A deep cleaning, though, or scaling and root planing, which we'll talk more about those terms in a second, is therapeutic. It is actually treating an active problem, so think of that as going to the mechanic. Because your check engine light is on, there's something wrong and it needs to be fixed. So there's a huge difference between these two types of cleanings. Number two, the underlying condition being addressed. For a regular cleaning, this is for patients who basically have healthy gums and they come in routinely to have their teeth cleaned. A deep cleaning is for patients who have been diagnosed with periodontitis, which is a more advanced stage of gum disease. And so the gums are inflamed and there's some level of attachment loss. And again, we'll talk about those terms in a second. Number three, the area of focus and procedure. With a regular cleaning, we are only working above the gum line. We do not go below the gum line. That's not a prophy. That is now considered a deep cleaning. So with a regular cleaning, we're cleaning the tooth above the gum line, removing any plaque and calculus or tartar that's on the tooth. With a deep cleaning, we're actually going below the gum line to clean the tooth and the root surfaces. So it's all the same stuff, plaque and tartar, but where it is on the tooth makes a big difference. The next thing I want to talk about is how much discomfort is associated with each type of cleaning. With a regular cleaning, usually there's no shots or anesthesia involved. The patient will feel some pressure from our instruments as we're scaling above the gum line, but there shouldn't be any pain. If the patient has any pain during a regular cleaning, then something is wrong and the dentist or hygienist needs to stop and figure out what the problem is. If a patient has pain when they're getting a deep cleaning, then that is expected because we are going below the gum line and working on the very sensitive root surfaces. So it's pretty uncomfortable, and that's why we use local anesthesia. And most of the time we do give an injection to numb that area, so the patient doesn't feel any pain during the procedure. The next thing I want to talk about is the time commitment for each type of cleaning. With a regular cleaning, it can usually be done in one single appointment. It takes approximately 30 to 60 minutes, depending on how many teeth need to be cleaned. With a deep cleaning, it takes longer. Very rarely can it be done in one appointment. Most of the time, it needs to be split into multiple appointments, sometimes over several months. That sounds like a lot of time, and it is. But this is a way that we can treat gum disease effectively and predictably. And the patient can still get the treatment done if it's spread out over several months. For follow-up with a regular cleaning, the follow-up is typically every 6 months. We want to see the patient back so we can keep those teeth and gums clean and healthy. With a deep cleaning, follow-up is even more critical. We want to make sure that the pockets are healed and closed. We want to make sure that the infection and inflammation is gone from the gums. So follow-up is very important. It's usually done at 3 months, then 6 months, then every year after that. And we're re-evaluating the patient, making sure that everything is healing well and staying healthy. Another important thing to talk about is the end result or the objective of each type of cleaning. With a regular cleaning, the result is a clean, polished tooth. We remove any plaque and calculus above the gum line, and the patient leaves with nice clean teeth and healthy gums. If they continue to practice good oral hygiene and see us regularly, their gums will stay healthy and they won't develop gum disease. With a deep cleaning, the result is healing. We don't expect the patient to leave with clean teeth. They have a little bit of debris on the teeth. Because we VA disrupted the plaque and calculus below the gum line, it's going to take a little bit before we can get that all cleaned out. But more importantly, we're looking for the pockets to be healed and closed and the inflammation and infection to be gone. So that's the objective. Reduce the periodontal pockets, eliminate the infection, and eliminate the inflammation in the gums. So let's talk about the terms scaling and root planing and how that relates to deep cleaning. So, scaling is the removal of plaque and calculus, similar to what we do during a regular cleaning, but we're going below the gum line to do it. So, we're cleaning all the way down to the bottom of the pocket. And root planing is smoothing the root surfaces so that the gum tissue can heal around the tooth without any food pockets left over. And the technical term for that is called a tight junction. So once we smooth the root surfaces, the gum tissue heals around the tooth with a nice tight seal, so no food can get trapped below the gum line. So that is the definition of a deep cleaning, scaling and root planing below the gum line. Periodontal pockets is another term that's commonly thrown around. What is a periodontal pocket? So, a periodontal pocket is the space or the hole below the gum line. So, normally there should be no space below the gum line. The gum tissue should be tight around the tooth, but with gum disease, the gums pull away from the tooth, and now there's a pocket or a hole below the gum line. And this is where the bacteria live and grow. And this is what we call a periodontal pocket. So the deeper the pocket, the worse the gum disease is. If a patient comes in and they have 4, 5, or 6 millimeter pockets all around, that's pretty severe gum disease. If they have 1 or 2 millimeter pockets, that's early gum disease. So the depth of the pocket tells us how severe the gum disease is. Another term that's thrown around is called attachment loss. And attachment loss is the amount of connective tissue that's holding the tooth in place that has been lost due to gum disease. So normally, the tooth is held in place by connective tissue called the periodontal ligament, and this is what allows the tooth to have mobility. The tooth isn't just cemented in there, it has some room for movement. That's normal and healthy. But with gum disease, that connective tissue breaks down and is destroyed. And as that happens, the tooth becomes looser and looser and eventually falls out. So, the more attachment loss a patient has, the worse the gum disease is. If a patient has zero attachment loss, they have healthy gums. They have no gum disease. Alright, thanks for watching this video about the difference between a regular cleaning and a deep cleaning. And again, this video is for educational purposes only. Always consult with your personal dentist for individualized oral care. Thanks for watching.